So I think हम अभी next session पर move करते हैं क्योंकि हमारे जो presenter हैं वो online मौजूद हैं. So I would like to welcome Saurav Bhattarai, who's with us online. He's going to continue the discussions we had on interoperability earlier in the morning and discussions that we've been having since yesterday. But he's also going to highlight some key considerations when going towards interoperability. So over to you, Saurav. Thank you so much for your time today.
All right, thank you very much. And let me just try to get the slides up. I hope you can see my slides. Can you see my slides? Can someone give a quick yes or no?
Yes, yes,
All right, perfect. Thank you. So good morning, good afternoon, everyone. My name is Saurav Bhattarai. I work for GIZ in a global program around social protection, so global alliances for social protection, focusing on the topic of digital social protection. And today, I wanted to go through the topic of interoperability and how how we've seen it done and what options there are. And it's very pertinent to the quiz that I was just listening to before on data privacy, because as we go more and more into digitization, there's a need to exchange data between systems. Privacy comes into play, data security comes into play, and therefore we need to look at all of these when we're looking at interoperability. But let's start with where we generally are in terms of social protection systems in many instances. So it's quite clear in many instances we have siloed digital systems. We have multiple digital systems that exist in the social protection landscape. There might be MISs for managing one program, beneficiary registry for another program, and another MIS, various systems, and these exist not because anyone intended to really fragment the system and create these potentially overlapping systems, but all of these were built for a specific purpose whenever they were built. And generally, when we look at digitalization, it was a process, or it still is a process, where some systems got digitalized before, owing to the resource availability, and maybe because of lack of resources, other systems got digitalized at a later stage, and that's just the way things happen. So it's not fragmented, it's not siloed by design. And the silos also existed even before we were at digitalization. All these systems had varied timelines. So as I mentioned, maybe there were some resources available for one program. Maybe a program that started much later had the luxury of starting from digital processes, whereas programs that started maybe 10 years before that, when digitalization wasn't cheap or easy, did not. So everyone had varied timelines. And of course, because these timelines varied, and because digitalization was done at different times, the technologies used were also different. Programming languages were different, could have been different. The communication protocols, communication styles, everything. Was a potential to for everything to be different, and that has caused these siloed digital systems. But what we have to see is that all of these systems did follow an organic growth. So and it's not only in one country or in one instance that this is the case. We see this worldwide, that systems had multiple systems exist. There was organic growth, and then we come to a situation now where we see, okay, there's a lot of need for connection between systems, but we have systems that can't easily talk to each other, and we need interoperability. And when we look at these, what I call here in this slide, legacy systems, these older systems, they were primarily designed to digitize manual processes. we had social protection programs, or we have social protection programs where we have the process of first identifying beneficiaries, registering them, and then providing them with benefits, and then doing some monitoring and evaluation around that process. And we designed digital systems to exactly mimic that manual process. And we gained a lot of efficiency. It's not that we didn't gain efficiency when we digitize, but these efficiency gains were mainly through the speed in which these processes could be completed. So we gained efficiency just because the computer was faster than the human. To do some of these tasks, to transport, let's say you do data entry, to move it into a database, all of these things were faster, and we saw that as efficiency gains. And that was correct. Those were a lot of gains that we gained, almost exponential compared to human speed. But then now we're seeing a flat line, because now we need to take the next step in digitalization, because we know that digitalization allows for changes in process design. So every social protection program doesn't need to follow the identify, register process in the way it's manually done, whereas everyone needs to fill out a form. We could have one identification, one registration process, and then multiple programs could tap into that information, so that we don't have to rely on those processes being completed for every program, and we can act faster and really have exponential growth in terms of efficiency. But which also means that now we need these siloed digital systems to work together, because the information might be in one but not in the other, and we need information and data to be shared seamlessly and to flow seamlessly. And again, that's
Sorry,
where,
Saurabh, just a quick
yeah.
comment here. I think you might need to unshare and then reshare your screen, because we only see the first slide. And if you go into presenter view, then we'll see where you are. Yeah.
Let me see.
Thanks.
So let me hold on. Let me stop sharing.
And in the
Now-
meantime, I've also sent it to the participants over WhatsApp in case you need to zoom into any of the figures. Thank you.
Sure. Is it any better? Or maybe I go into presenter mode. Hold on, sorry.
Yes, sir, it's okay now.
Okay. I'll just go into this mode. That way we see all of them. No?
No, it's not
so
okay now.
now it's not.
Yes, the previous view was okay.
Okay, let me try one more time. This is okay?
Sir, it's okay. Can you on presentation mode, please?
Okay, let me try presentation mode. Yes?
No, it's stuck.
So it seems like I can only do one thing at a time. Maybe you could share the screen there. I can just say next slide. Would that work?
Oh, okay. Okay, no issue.
Just let me know when you have the slides on there, and then I could continue. Perfect. If you could go to slide 4, one more. There. Thank you. So as I was saying, so for interoperability, to gain these efficiencies, we see that we need to connect these siloed systems for data exchange. So for many functions, one could be verification. So when we need to verify, let's say, the identity of a beneficiary, it could be you have one system talking to another system to verify. For beneficiary data sharing, and in the I'm just referring to the previous um, uh, quiz that you had in terms of data privacy and data sharing. So keeping all those in mind and having the proper privacy protocols in place, there could still be beneficiary data sharing between various systems. So interoperability would allow for that. For payments, including reconciliation of payments after they've been made, you would need social protection systems to talk to most likely banking systems, either digital mobile banking or regular banking systems, to make sure that the benefits are paid out, and then you're able to reconcile those payments that come in or that have gone out, to make sure that your accounts are in order. Um, and when we're looking at this interoperability, we can see two options. No, one, we can connect individual systems to basically what I've been saying so far. You have one system, you need some functionality, you can connect to another, or through using an interoperability architecture. So these are the two options. So let's look at examples of either of them. So the first one, when we're looking at connecting individual systems, if you can press through, there's a few animations, I guess. Next slide, please. If you just press there, thank you. So if you look at OpenIMIS is an open source technology and open source software for managing various social protection schemes. It's used in a variety of countries and in different schemes worldwide. But here, let's look at how interoperability is used. So the OpenIMIS system remains in the middle. So that's the main MIS for, let's say, any social protection program that that's managing everything. But for beneficiary management, we might need to communicate with another beneficiary management system. If it's a formal sector scheme, even getting employer data and employee data, because the SPMIS, like OpenIMIS, might not have all the data in there. So we need to connect to another system or a social registry or a dynamic social registry to make sure that you have the latest beneficiary management, beneficiary data for beneficiary management. On the left, again, as I talked about previously, you would need interoperability with payment systems, with banking systems. So either be it for if you have a contributory social protection scheme for contribution collection of funds, or for cash transfer to beneficiaries. So for either incoming or outgoing payments, you would need this interoperability with the banking systems. For data analysis, maybe the SPMIS it doesn't have all the information that you need to have a holistic view on your social protection program. So there might be a need to interact with another business intelligence or data analysis software. So in OpenIMIS, an example was done with DHIS2. Next slide, if you could click through. Yeah, and then also for claims and feedback, we in OpenIMIS we've interacted with, for example, in the health sector, with electronic medical record system, so that you can get data directly from the health facilities if you're running a health insurance. But one of the key things that is the same in all these different connections that you see is this grayed shadowed box on towards the edges of the OpenIMIS box, which are standard interfaces. So interoperability is possible between between OpenIMIS and these other systems, because there is some standard interface that allows different systems to talk together, and that is key, and we'll look at that a little bit further as well. So this is the option of connecting individual systems. You could have such an architecture that is very much used in practice as well. But also let's look at the next example, which is also from the health sector, on an architecture approach. What you see here is a reference architecture. So this is for practitioners to look at and just take what they need, but it comes from the health sector, so it's not social protection specific. But I think there are a lot of things that we can take in understanding how interoperability in such a architecture approach can work. So this is what we call the Open HIE, the Open Health Information Exchange. But here you have many systems, the various MISs, the various program MISs. So it could be cash transfer schemes or voucher schemes or various or health schemes at the very bottom. These are point of service systems. So you can have different MISs for these various systems and run in your individual agencies as well, because the various programs might not have the same social protection agency running it, and even if there is, there might be need to have these individual systems. But all of these systems communicate through this green interoperability layer that's in the middle, that help in connecting with very core functions. So in the health example, they have something called a client registry, which is synonymous to a beneficiary registry in social protection. So we could have a social registry or an integrated beneficiary registry. So there would only be one registry that multiple systems can use. And the difference between what we saw before and this is we wouldn't need every MIS connecting to the beneficiary registry, but instead every MIS would connect to this interoperability layer, which is also connected to the client registry, allowing for free flow of information. And what that enables is it enables us to create many MISs easily and communicate with the core system. So every MIS doesn't need to understand how to connect to the client registry. And we have another example here, the facility registry in health. These are the hospitals that are registered in the country. In social protection sense, these could be banks, so that provide the cash out. So all the banking information could be in one system that goes through the interoperability layer. So this is one reference architecture that could be used. It saves from having resources made available to connect each and every MIS to each and every the core system on the top. So you use what we call an interoperability layer or an exchange layer in between, which is connected to most of the core services, and then individual programs just worry about designing their MISs and connect to the interoperability layer. So what you saw before, and these are two examples. There are advantages and disadvantages to both. So if you have a very small interoperability need, the previous system is much more fast to get up and running. You have one system, maybe you just connect it to one or two other systems, and you are done. But if you are starting to build a more complex system with many MISs that need to be connected, this architecture approach might be the way forward. Next slide, please. So, but when we look at either of those two examples, the one thing that is key, which I mentioned in the first one as well, is that standards. We need standards for data and then for exchange. So the systems that these various systems need to adhere to some kind of agreed standards between the various social protection programs and between the different MISs. They could have data differently within themselves, but they need to agree that when exchanging data, this will be the standard that we exchange it in. Otherwise, we will never be able to have a seamless interoperability, because we just won't be talking about the same thing if we don't agree on standards. And these standards, and this is really key. So defining these standards and agreeing on them is not an IT issue. This is not an IT problem. This is really a policy issue. So the standards, what we need to exchange, in what standards should these data be stored, how should they be exchanged, it should be governed by policy. So it should have data protection inbuilt. You need to think of privacy, who owns the data, what is allowed to be shared, who gives permission for sharing. All these things need to be governed by policy. And it is only the IT that will implement it. So we really, the message that I'm really trying to put forward here is that interoperability, while it seems like an IT problem, while it seems like IT should be responsible for interoperability, the core aspect of it is really with the policymakers. IT is only implementing what is agreed in policy through the governance of these SP programs. So the standards are very important, but it needs to be led by the social protection programs and the policy processes there. Next slide, please. And to do these, to develop these standards, there is from the USP 2030, the Universal Social Protection 2030 initiative, an initiative around standard building has been established, the Digital Convergence Initiative, or the DCI, to basically to get together governments, development partners, private sector, everyone to come up with a set of standards that anyone could use or reuse. So basically, the idea is to form a consensus-based open standard so that every country doesn't need to reinvent the wheel for standards for interoperability, to enable that, to enable innovation so that different IT products could use the same standards, thereby reducing time and costs, and then ensuring that systems are future-proof, because if you have a system today adhering to standards, tomorrow the upgrade could also be the same, using the same standards. Next slide, please. And how the DCI does this approach, and you're very welcome to join. At the end of the slide deck, you'll see some ways of joining the Digital Convergence Initiative as well. But just to give you an idea, the DCI, which is also the secretariat is housed at GIZ. They do a lot of talking interoperability webinars, so that you get more of what you're hearing from me in more depth in country examples and practical examples. They enable partnerships between various open source solutions and other initiatives around this area. Provide interoperability in action workshops, which lets you see hands-on how two systems could interact and how you could potentially use that in your settings as well. And then and that all accumulates into a committee that forms a standard for a certain use case. Right now, they just finished working on interoperability between CRVS and a social protection MIS. But the standards committees would form this. Next slide, please. So at the end, so achieving interoperability, I think it's we all agree that interoperability is needed and is key, but we now understand, or we should understand, that this is a multi-stakeholder process, and it's not just IT teams who are at on this list at the bottom. It really starts with the policymakers, the program implementers. They need to be clear on what data needs to be exchanged, why it needs to be exchanged, and how it is exchanged. Not on how the IT exchange happens, but at a policy level. And we need to look beyond sectoral silos as well. So we talked about digital systems being in silos, but we know in many of our implementations, we have sectoral silos. We have social protection, not speaking with health, or not speaking with finance within a country or within a region as well. So we really need to break those silos and make sure that we're looking at interoperability in a much more holistic manner than just within the sector. So basically my last point is that the IT part, from my experience, is easy. The processes before that we need to do to get there, to ensure collaboration between our various stakeholders, is requires more effort and really careful planning, so that we come up with interoperability architecture. So with that, I thank you all very much for your time. I know I'm the only one holding you back between lunch and yourself. So, but if there are any other questions or any questions, I'd be happy to answer them. And right now, or even beyond, I'll leave all my contact details with the organizers so we can chat about it later as well. Thank you very much.
Any questions from the house? Thank you, Saurabh. It seems that you were very loud and clear in your presentation, and people have enjoyed it. And there is no such questions. I don't see any hand raised at the point, but if there are something, perhaps they can reach out to you on your email.
Absolutely.
Thank you so much for your presentation, and thanks for being with us.
All right. Thank you. Bye-bye. Have a good day, everyone.
So with this, we close the technical session. At the moment, we will be breaking for lunch, and we will return to this hall by 2. Make sure that we are here, because we are going to start the next session at 2. The lunch is served in the next room, where the tea was served early in the morning. Thank you.